Welcome back, everybody, to another deep dive. This time, we're looking at a document you sent our way.
It's the draft statement of work.
Right, the draft statement of work for the Medicare Drug Integrity Contractor.
Or MEDIC, for short.
MEDIC, yeah. And this is really interesting because it's like we're getting a sneak peek into the future of Medicare Part D.
Yeah, absolutely. A look at how they plan to crack down on fraud and abuse in the prescription drug space.
And I think that's something that affects everyone, really, whether you work in healthcare, you're a beneficiary. You know, we all have a stake in making sure that the system is working properly.
For sure. And this document really gives us a glimpse into how they plan to do that.
So let's dive in, starting with the basics. What is MEDIC? What's its mission?
So in a nutshell, MEDIC is an independent contractor that CMS hires.
CMS being the Centers for Medicare and Medicaid Services.
Right. Yeah, exactly. And they're basically the watchdog specifically for Part D.
Okay, so like a specialized detective agency for prescription drugs?
Exactly. They'll be analyzing data, conducting audits of insurance plans, and they can refer potential cases of fraud to law enforcement.
So they're really tasked with protecting the Medicare Trust Fund and also making sure that beneficiaries aren't put at risk.
Absolutely. And it seems like they're taking on a bigger role than previous contractors have.
So this document signals a shift then?
Yeah, I think it does. We're seeing that CMS is separating the oversight of Part C and Part D.
And just to remind everyone, Part C deals with Medicare Advantage plans and Part D covers prescription drugs.
Right. And so this new MEDIC contractor is going to be solely focused on Part D.
Okay, that makes sense because the two programs are quite different in how they operate.
Yes, definitely.
So what kind of information will they be using to sort of sniff out these potential problems?
Well, the document is very specific about that. We're talking about claims data beneficiary information, even data from outside sources like the Office of Inspector General and professional societies.
Wow. So it's really a vast amount of information they have access to.
It is. It's like they're piecing together this giant puzzle, looking for anything that seems out of place.
And they're not just passively collecting data, are they?
No, they're actively looking for patterns, trends, anything that might point to fraud.
So can you give us an example of what would raise a red flag for them?
Sure. So imagine they see a sudden spike in prescriptions for a specific drug in one particular region.
Okay.
That could indicate that something's amiss. You know, maybe there's overprescribing by a doctor or a pharmacy billing for medications that weren't actually dispensed.
Oh, I see. So it's about looking for those anomalies, those things that just don't quite add up.
Exactly. And they're not going it alone, right? The document mentions all sorts of partners.
That's right. We're talking about the FBI, the Department of Justice, state agencies, even other Medicare contractors like the CPIC, which focuses on Part C.
Yeah, it's like a whole task force dedicated to keeping the system honest.
That's a lot of firepower.
It is. And this is just the beginning. We haven't even touched on the different types of audits they'll be conducting.
And that's something you, our listener, might be particularly interested in, especially if you're involved with a Medicare plan in any way.
For sure, there are national audits, self-audits, where plans review their own data, and even targeted audits based on specific risks identified by MEDIC.
So plans really need to be prepared.
They do.
Okay, so we know they're kind of taking over some existing programs, but there's also something new on the horizon, right?
You're talking about the changes coming in 2025 with how people can pay for their drugs.
Exactly. Starting in 2025, plans will have to offer enrollees the option to pay for their medications through these capped monthly installments.
Right.
And the document specifically mentions that MEDIC will be involved in overseeing this new program.
Yeah, it's a significant change. And clearly CMS is bringing in MEDIC to make sure that everything runs smoothly and there are no loopholes for fraud or abuse.
It makes sense anytime you introduce a new payment model, there's the potential for someone to try to game the system.
Exactly. So for those of you listening who work with Medicare plans, consider this a heads up. MEDIC will be watching closely.
Now, before we kind of dive deeper into the specifics of MEDIC's operations, there's something else that really stood out to me in this document, and that's the emphasis on transparency and education.
Yeah, I agree. That's crucial.
MEDIC is expected to issue alerts, conduct training, and work with various groups to spread awareness about fraud and prevention strategies.
I think that's really important. It's like they're saying we're not just here to catch the bad guys. We're here to empower everyone to be part of the solution.
Right. The more informed everyone is, from healthcare providers to beneficiaries, the better equipped we'll be to combat fraud.
Absolutely. It's a collective effort.
Okay, so that covers the basics of MEDIC's role.
Okay.
Are you ready to take a closer look at what they'll actually be doing?
Wait, Stu, let's dive into the details.
Perfect.
Okay, so we've established that MEDIC is stepping up enforcement, but what will that actually look like in practice? You mentioned audits earlier.
Yeah.
Let's start there.
Yeah, the document outlines several types of audits, and it seems like they're designed to keep everyone on their toes.
Absolutely. First, we have self-audits, where Part D plan sponsors review their own data for potential issues.
Okay.
And it's a way for them to proactively identify and correct problems before Medic comes knocking.
So it's kind of like a self-checkup.
Exactly. Then we have the national audits.
Okay.
These are larger scale audits that CMS initiates, and Medic will examine data from multiple plans to identify broader trends and issues.
And these audits will be focused on specific areas, right? Not just a random check of everything.
You're right. Medic will identify potential areas of concern based on their data analysis complaints they receive other sources.
So they're really targeting their efforts based on where they see the highest risk of fraud, waste, or abuse.
Exactly.
Can you give us an example of what one of those high-risk areas might be?
One area that often comes up is crossover claims for services or medications that could potentially be billed to both Medicare Part D and other parts of Medicare like Part A or B.
So making sure things are billed to the correct part of Medicare
Right.
seems like a detail that could easily slip through the cracks.
It absolutely can, and those kinds of issues can quickly add up to significant costs. But audits are just one part of the picture.
Okay.
The document also outlines a range of other activities that MEDIC will be responsible for.
I'm all ears. Give us the rundown.
Well, they'll be issuing plan sponsor alerts. These are essentially warnings to plan sponsors about potential fraud schemes or trends that MEDIC has identified.
So like a heads up to be on the lookout for specific red flags.
Exactly. And if a plan is found to have significant compliance issues, MEDIC can issue what are called targeted compliance notifications.
Okay. And I imagine those are a bit more serious than just a heads up.
You could say that it's essentially saying, hey, you need to fix this problem and fix it fast, or there will be consequences.
I bet those get everyone's attention. But it's not all about audits and warnings, is it?
Right.
The document talks about data analysis as a way to proactively identify potential fraud.
Right. They're not just reacting to problems. They're trying to get ahead of them. They'll be using sophisticated tools and techniques to analyze all that data they have access to, looking for patterns, trends, anomalies that might indicate fraudulent activity.
It's like they're playing detective with data.
A very apt description, and they'll be developing reports based on their findings, sharing those insights with CMS and other stakeholders.
So they're really taking on a role as a central source of information and expertise when it comes to fraud in Part D.
Exactly, and part of that role involves education and outreach. The document mentions that MEDIC will be responsible for training programs and working with various groups to spread awareness about fraud and how to prevent it.
But we touched on that earlier, the idea of empowering everyone to be part of the solution.
It's really a multi-pronged approach. They'll be conducting national training sessions to educate plan sponsors, law enforcement, other stakeholders about the latest fraud schemes, trends, investigative techniques. They'll also be participating in more targeted events focused on specific fraud issues.
Wow. It sounds like they have a really comprehensive plan in place. It's quite impressive.
It is, and another thing that stands out to me is the emphasis on coordination and collaboration.
Okay.
MEDIC won't be operating in a vacuum.
What do you mean by that?
They'll be working closely with a whole network of partners, including other Medicare contractors, law enforcement agencies, state agencies, even professional societies. It's a true team effort.
Makes sense. You need all hands on deck to effectively combat fraud.
Absolutely. The document even specifically mentions joint operating agreements, or JOAs.
I remember seeing those formal agreements to define roles and responsibilities between MEDIC and its partners.
Yeah.
So basically making sure everyone is on the same page and working together smoothly.
Precisely. Communication and information sharing are critical in this fight against fraud. So we've talked a lot about what MEDIC will be doing, but what does all this mean for our listener? Why should they care?
That's the key question, right? What are the implications of all this?
If you're involved in Medicare in any way, whether you work for a plan, a provider, or are simply a beneficiary, you need to be aware of MEDIC's role and how it might impact you. They are going to be a powerful force in the Part D landscape.
No doubt about it. And understanding their strategies, the data they'll be using, the types of audits they'll be conducting could be incredibly valuable.
It's all about being prepared, being informed, and being proactive in protecting yourself and the integrity of the Medicare program. Now, remember how we talked about MEDIC's role in identifying program vulnerabilities?
Yes, you mentioned that earlier. It's not just about catching existing fraud, but also about looking ahead and anticipating future risks.
Exactly. They're trying to spot potential weaknesses in Part D that could be exploited down the road. It's a pretty fascinating aspect of their work.
It really is. And I'm curious, based on what you've seen in the document, what are some potential weaknesses in Part D that you think they might uncover?
That's a great question. It's tough to say for sure, but I have a few thoughts based on the areas they seem to be focusing on.
I'd love to hear them.
Well, one area that might attract their attention is the use of prior authorizations for certain medications.
You mean when a patient needs approval from their plan before they can get a specific drug?
Exactly. While prior authorizations are often necessary to ensure appropriate use of medications, there's also potential for them to be misused or abused. For example, if a plan makes the prior authorization process overly burdensome or denies requests without proper justification, it could be seen as a barrier to care.
I see, and that's something Medic might investigate.
Another area that could raise red flags is the increasing use of specialty drugs.
Those are the really expensive ones, right?
Right, and they're becoming a larger and larger part of Part D spending, and I imagine that naturally attracts scrutiny.
It does, and it's not necessarily about fraud in those cases, but more about potential waste or abuse.
Sure, imagine a scenario where a doctor prescribes a very expensive specialty drug when a more affordable and equally effective alternative is available. That would be considered wasteful spending.
Okay, that makes sense, and that's something Medic would be looking out for.
Absolutely. They'll be analyzing prescribing patterns, looking for any outliers or anomalies that might warrant further investigation. So for doctors who prescribe Part D medications, it's important to be mindful of costs and ensure you're always choosing the most appropriate treatment options.
It sounds like Medic scrutiny is going to impact a lot of different players in the Part D space. What about pharmacies? Any potential issues there that they might be looking at?
Well, one area that often comes up is medication adherence.
Adherence, you mean making sure patients are actually taking their medications as prescribed?
Exactly. Medication non-adherence is a huge problem, both in terms of health outcomes and healthcare costs.
How so?
Well, think about it. If a patient isn't taking their medications as prescribed, it can lead to their condition worsening. That could result in more doctor visits, hospitalizations, even more expensive treatments down the line.
The domino effect.
Right, so Medic might be looking at pharmacies' efforts to improve medication adherence, making sure they're providing patients with the support and resources they need to properly manage their medications.
So pharmacies need to be proactive in supporting their patients, not just filling prescriptions and sending them on their way.
Exactly. It's about taking a more holistic approach to patient care. And it's not just about patient care, it's also about protecting themselves from potential scrutiny.
We've covered a lot of ground here. But I have a feeling we've only scratched the surface of what Medic will be doing and the impact it will have.
I think you're right. There's so much more to explore.
Indeed. And we'll do just that after a quick break. When we come back, we'll delve into some of the specific tools and resources Medic will be using to carry out its mission, and we'll discuss some of the broader implications of this new era of Medicare oversight. All right, so we're back and ready to wrap up our deep dive into the world of Medic. We've talked about their mission, their strategies, and the potential impact on different parts of the healthcare system.
Right.
But let's zoom in now on the tools and the resources that they'll be using to carry out this ambitious plan.
Yeah, the document provides some pretty fascinating insights into how they're going to be tackling this complex task. And, we're not just talking about manpower here. We're talking about some serious technological firepower.
Yeah, that's what I'm curious about. What kind of tools are we talking about here?
Well, first and foremost, they'll have access to a vast amount of data from various CMS systems.
Okay.
We're talking claims, data beneficiary information, enrollment, details, even pricing information for medications.
Wow, it sounds like a data analyst's dream come true. So much information at their fingertips.
It is, but of course having data is one thing, making sense of it is another. That's where their sophisticated tools come in.
Okay.
One of the key systems they'll be using is the Integrated Data Repository, or IDR.
IDR. Okay, what's that all about?
Think of it as a massive data warehouse. It combines information from all those different sources, giving Medic a really comprehensive view of the Part D landscape.
Gotcha.
So they can connect the dots and spot patterns that might otherwise go unnoticed.
So they're not just looking at individual pieces of data in isolation.
Right.
They're seeing the bigger picture.
Precisely. And then there's the One Program Integrity Portal, or 1PI.
All right, another acronym. Help me out here. What does this one do?
So 1PI is like a specialized toolkit designed specifically for fighting fraud, waste, and abuse.
Okay.
It allows them to run complex analyses, generate reports, share information with other stakeholders that are involved in investigations.
So it's like their command center for coordinating all these efforts.
Exactly. And of course, they need a way to manage all those investigations.
Right.
That's where the Unified Case Management System, or UCM, comes into play.
Okay, I'm starting to see a pattern here. A lot of acronyms and a lot of interconnected systems.
You're not wrong, but the key takeaway is that Medic will have a powerful arsenal of data and tools at their disposal,
Yeah.
enabling them to conduct really thorough and efficient investigations.
It does make you wonder, though, with all this data and these powerful tools, is there a risk of overreach? Could this feel a bit like Big Brother to some people?
That's a valid concern, and it's important to remember that with great power comes great responsibility.
Yeah.
But I think it's also important to see the other side of the coin. This kind of oversight is ultimately about protecting Medicare and ensuring that taxpayer dollars are being spent responsibly.
That's a good point. It's about finding that balance between protecting people's privacy
Yeah.
and safeguarding the integrity of the system.
Exactly. And it's not like Medic will be operating in a silo, as we discussed earlier. They'll be coordinating with other agencies and stakeholders, the FBI, the Department of Justice, state agencies. It's a collaborative effort.
Right. It's about bringing all those resources together
Yeah.
to create a more comprehensive and effective approach to combating fraud.
Exactly. And I think that's a really important point to emphasize. This document isn't just about laying out Medic's responsibilities. It's about signaling a shift in how Medicare is approaching the issue of fraud and abuse. It's about taking a more proactive and data-driven approach.
And for anyone involved in the Medicare Part D world, it's a clear call to action. Stay informed, stay vigilant, and make sure your own practices are above board.
Couldn't agree more. This is a new era of oversight, and those who aren't prepared could find themselves facing some serious consequences.
So as we wrap up this deep dive, what's the key takeaway you'd like our listeners to remember?
I think the biggest takeaway is this Medic is coming, and they're bringing a whole new level of scrutiny to the Part D program. They'll be using data technology and a network of partners to identify and root out fraud, waste, and abuse.
It's a game changer for sure.
Absolutely. And while we've covered a lot of ground today, I encourage our listeners to delve into the document themselves and really familiarize themselves with the details. There's a lot to unpack, and the more you understand, the better equipped you'll be to navigate this new landscape.
Excellent advice. Knowledge is power, as they say. And on that note, I'd like to thank you, our expert, for guiding us through this complex and fascinating documentation. Your insights have been invaluable.
My pleasure. Always happy to shed some light on these important issues.
And to you, our listener, we hope you found this deep dive informative and engaging. Remember, the world of Medicare is constantly evolving, and staying ahead of the curve is essential. Until next time, stay curious and stay informed.